Hello, and welcome to our brand new podcast series, Decade of Excellence Reimagining Human Health. Through this series, we'll be celebrating the 10th anniversary of our bioengineering department here at the University of Texas at Dallas. My name is Shalini Prasad, and I am the department head for the bioengineering department.
Welcome back to this episode. My guest today is Dr. Manasi Reardon. She is the head of advanced development neuromodulation at Abbott Labs. She has a bachelor's in instrumentation engineering and a PhD from University of Iowa in biomedical engineering, and her focus there was vascular biomechanics. Manasi, welcome to this podcast episode where we're discussing the cross-disciplinarity of biomedical engineering and its impact on the biomed and medtech industry. Let's start off. Tell us about your background. What led you to pursue a career in biomedical engineering?
Thank you so much for having me on the show today, Shalini. It's really my pleasure to be here. When I think about my background, I have to go back to my childhood, which was really my first exposure to health care, where I grew up with physician parents who ran a small hospital in rural southern India. Really, medicine and disease state management was part of growing up. It was part of dinner conversation after school in our little hospital where looking at microscopic slides from blood work at the hospital while the lab tech kind of helped me with homework was a normal evening after school. So without even knowing it, I think I grew up with a fascination for medicine. And it really became a career option for me when I did an internship at Philips Medical Systems in Chennai, India, where I put together this childhood fascination and a career option where you can have a real impact on patient lives. So that was really how I was exposed to the biomedical engineering field. And when I looked into various different options, and it seemed like the best option for me was to pursue a higher education in specializing in the field. And so I decided to pursue my PhD here in the US at the University of Iowa.
That's so fascinating. And the childhood experiences always drive us to decision making in our lives, which kind of drive us to our careers. And it's really, I'm so happy you've shared this with our students and our listeners. So what comes to your mind when you hear UTD Bioengineering?
It's really expertise, collaboration, and rapid growth. I think your expertise in the engineering discipline, your collaboration with institutions like UT Southwestern's medical school, your ability to scale is extremely impressive. Don't you guys have like a 10,000 square foot of space for future programs available? I think the program has scaled amazingly and it has so much more potential. And that's what comes to mind when I think of UTD Bioengineering.
You're absolutely right in terms of the impact of a collaboration between an academic partner and multiple industry partners and building this public-private partnership. This is something that we see is in our future for UTD Bioengineering. And I'm glad you recognize the investments that are going towards trying to do that. So one of the greatest healthcare challenges that you've seen here today in biomedical engineering is, of course, the COVID-19 pandemic that we're dealing with. So what do you think that the biomedical engineering industry is doing to address this? And are there any other challenges that the biomedical engineering industry can seek to address in the future?
I think with COVID, the several different aspects of the healthcare industry has come together to solve this problem in totally different ways, whether it's testing, whether it's vaccine development, whether it's care delivery, whether it's how can we distribute our care providers in a way to cater to the pandemic. I think the industry has come together in such in such an amazing way. But I think COVID is very, very top of mind for us because it's happening and it's affecting all of our lives in very real ways. I think there are also other things, like you said, Shalini, that are applicable to healthcare challenges that the biomedical industry is actively taking on or is right around the corner for us to take on. For example, I've been really impressed with how the industry is putting together digital tools to serve patients better. The diabetes industry in particular, I think has done this very, very well, where they've empowered the patient. They've given them the tools to understand the disease, to monitor the disease, and to have the agency take control because they have access to their own data. They can monitor their own data, and it's hugely impactful for younger, older, like a whole spectrum of diabetics in the country and in the world. Other industries like ophthalmology, orthopedics, otolaryngology have all followed suit on this as well. And I think with these digital tools, for serving patients better, we have so much opportunity. Every other field in the biomedical engineering industry is going to tap into this, and I think has amazing opportunity to tap into it.
So if I'm a student in the biomedical engineering program, so one of the things that I would wonder is what are some of the key skills for having a career or pursuing a career in biomedical engineering? Could you talk to us a little bit about that?
Yeah, absolutely. The important thing when you're a student in biomedical engineering is to pick a specific area where you build a certain amount of expertise. When I say certain amount of expertise, I'm specifically talking about design and testing experience in certain areas. Maybe that's mechanical, maybe that's electrical, maybe that's something digitally oriented. That's really, really important because biomedical engineering allows you to be broad, but at the same time, you have to have some sort of a specific skill that you bring to the table when you're looking for a job. That's one thing. The second thing is the ability to work in a multidisciplinary environment. I think this is a unique thing for our biomedical engineering students, where they're often talking with physicians, they're talking with other engineers with completely different backgrounds. So mechanical engineers working with electrical engineers and software engineers. So they're often having to talk a language that might not be native to some of their other coworkers that they work together on a daily basis with. So it's really important to be able to work in a multidisciplinary environment. And then the third thing is to understand the regulatory processes. We work in the regulated industry. A lot of our devices are regulated, and they're regulated at different levels. So it's really important to understand the implications of the different levels of regulations, being regulated, and so on. Those are probably the three things I would advise students who are pursuing biomedical engineering to develop their skills in.
That's a great piece of advice to our students. So what types of opportunities are available to those with a BS in biomedical engineering? And what are the opportunities there for graduate students with MS and PhD in bioengineering? Considering that UT Dallas has the fourth largest bioengineering program in the United States for the undergraduates and has got over 100 graduate students.
That's really impressive, Shalini. I think this quality and quantity of students that you have graduating from your programs is very impressive. When I think about BS in BME, I think they have a lot of opportunities, not only in the medical device industry, but also in the pharma or the biotech industry, depending upon what their focus area was. Even within the medical device industry, if you think about the different areas that are available to them, there is imaging, there is a whole slew of catheter-related devices, there are a whole slew of digital health-related devices. So they could go into any of these areas. I think the important thing is to start in a focus area that has promise in the near future, and to start targeting companies for internships and to start networking with folks in the companies early, not wait until the 11th hour when you absolutely need a job or want a job, but rather start thinking about it earlier on, where maybe you want to go try an internship and then you will learn that this as much as I thought I would. And then you have time to course correct. And then that's how you end up in a place where you are truly satisfied with your career, right? So I would say start with your focus area, try it early, and then course correct.
That's a great piece of advice. So, Manasi, you were the Stanford Biodesign Fellow, and there is really truly immersive integrative experience in the biomedical engineering field. That's the focus of that program. So keeping that in mind and thinking about students, especially during the pandemic times when students are graduating, there's a great deal of anxiety. And there is also concern about perhaps lack of immersive experiential learning. So what do you suggest to these students in terms of advice, especially these are biomedical engineering students graduating in these tough times?
That is a really good question. I think they are facing a challenge that is unprecedented. Like, we've never faced something like this, and the entire world is facing it together. So I completely understand the anxiety, and it's real. When I think about immersive experience, this is where we have to use digital tools. This is where we have to figure out, are there opportunities for front-end work that is still accessible in today's world? And are there ways, and this is not going to, the COVID situation or these lockdowns aren't going to go on forever, right? So are there things that maybe was lower on the priority or we were planning to do later on that we can pull in and kind of swap with this immersive experience that can potentially be pushed out? So those are some of the ways I would encourage the students to think about and kind of continue to have agency. Don't feel like their career or their options are limited, but rather use the constraints as challenges rather than barriers.
And I wanted to end by asking you a more big picture kind of a question. So, looking into the future, what do you think are the greatest challenges facing the biomedical engineering industry?
There are quite a few challenges for us to overcome, both in the near term and the far term. From a technological standpoint, one that kind of stands out to me is, how do we integrate all the data that is currently available being collected at a patient level? How can we harness that to deliver better patient care? I think the medical device industry, the med tech industry more broadly, is working on this. And there have been some non-traditional players that have jumped on board as well, like Apple, Google. So I do think we should be able to crack the code really soon. But thinking about that, being very thoughtful and methodical in understanding what are the patient needs that can be met by the availability of big patient level data, big data that's collected at a patient level. I think that's a challenge that we need to overcome in the more nearer term than farther term.
Thank you, Manasi, for your insightful ideas in this podcast. Your thoughts would be of great value to our students, our graduates along the bachelor's, master's, and PhD levels. It is very important in these times of a pandemic how we can leverage digital resources effectively towards driving the building of our careers. And your insights, especially being a postdoctoral fellow at the Stanford Biodesign Institute and in your current position at Abbott, you're able to give us an insight about that. So thank you very much.
Fantastic, Shalini. Well, thank you so much for having me on the show. I really appreciate your time. And if there is anything at all I can do to support the students, support you, support UTD Bioengineering, please let me know.
Thank you for being a great supporter of bioengineering at UTD.